Hello guys, my name is Dr. Hamad. I am one of the emergency physician here. I would like to talk about today is the basic airway maneuvers and the techniques. If any patient who is become unconscious and having an airway problem, so what do we do now? So the airway starts with the basic airway with the positioning first of all. So the positioning is, this is the mannequin and this is supposed to be a patient. So first of all, the position is very important. So first of all, hello, are you okay, sir? If the patient is not answering, it means that airway is a problem. So once the airway is a problem, so first maintain the position, head tilt and chin lift. And along with that, apply oxygen mask with the high flow oxygen. Head tilt, chin lift. You are hearing the noisy breathing is still on, and you are thinking that it's not going to work. So even with the non-rebreathing mask, 50 liter oxygen, the next step is to put the Giddle's airway. So this is the Giddle's airway. This is the Giddle's airway, the oropharyngeal airway. So how to measure it? This is the important thing. The rule is angle to angle. This angle of the mouth and this is the angle. So angle to angle. The angle of the mandible, angle of the mouth. This is the appropriate size. Okay. Then how you put it? You put it first to the backward like this and rotate it to the 180 degree. And attach again the oxygen mask. And see, is there any noisy breathing still on? Yes, there is a noisy breathing still on, and patient is not having is having a problem with the airway. Anyway, so this is one of the option. The second option what we have? The second option is the nasopharyngeal airway. This is the nasopharyngeal airway. First lubricate it, and how to measure it? The measure is tip to tip. The tip of the nose till the tip of the earlobe. Okay, so you have to insert it with the rotating movement. Rotating movement, it will ease to pass the patient nasal airway. It will go beyond and it will go inside. So this is the nasopharyngeal airway. We have to pass in a rotating fashion. If there is any no contraindication of passing the nasopharyngeal airway, which may include facial trauma, facial burns. So what will happen? If there is not going inside or having a difficulty, you have to remove it, and then you have to start with the bag valve mask ventilation. Attach it with the oxygen. The oxygen will be attached from here, and C and E technique. This is the C and this is the E technique. You have to umbo bag. One thing you notice, these two ports are the lungs and this is for the gastric port. The umbo bagging, somehow air will go to the stomach as well. So this is the temporary measure. If you can see properly, the air is also going toward this end as well. This end is our stomach end. These two are the lungs. So please keep in mind that by doing umbo bagging, you are also inflating the stomach anyway somehow. So for the next step, you have to prepare yourself, which we will talk about later. Thank you very much.